So if you suffer from lower back pain or you feel like you've got a weak lower back, I'm going to tell you today that strengthening your lower back is not the solution, purely because there aren't any muscles of strength that surround the lower back / lumbar spine region. So what I'm going to do today is I'm going to give you a framework to bring about stability in the lower back / lumbar spine region, which is going to help you to alleviate any low back pain that you may have, and it's also going to help you perform your exercises efficiently and effectively. Before we go on, this framework has been exclusively developed and extracted from my learnings with Prescript in the level 1 course, so if you want to look them up, I'm going to link them below. So a very important structure that we're going to be concerned with in this video is the thoracolumbar fascia, which is basically a sheet of fascia in the small of the lower back from which multiple muscles, important muscles, originate from. So you've got the gluteus maximus, the latissimus dorsi, the internal oblique, and the transversus abdominis. And I'll be going into a little bit more detail with those muscles and the exercises which we're going to use to train those muscles during this video. So the first thing that we need to do is ensure that the body is in the best position possible, and so the thoracolumbar fascia is in the best position possible by which to train the muscles that originate from it. And so in order to provide that foundation, we need to stack the rib cage on top of the pelvis. And so I've already made a video on this that I will link below, but essentially we want to ensure that we're never in this position here whereby the lower back is essentially compressed in any exercise that we do really, and we need to ensure that the rib cage comes down and the pelvis comes to neutral. Okay, this is your stacked rib cage position, and if we maintain this stack, and I'll be talking through this and all of the exercises that I show in this video, we're going to be training in a manner that's going to ensure that we're training safely, effectively. Fascia is in the right position, and the muscles that attach to the fascia, namely the thoracolumbar fascia, are going to be trained in a manner that's going to be conducive to improve performance, that's going to help us to potentially get out of pain and make us feel like the lower back region is getting stronger. So our next approach is to work on spinal stability. Now, much of our spine stability is actually externalized in the form of sitting around all day, and so we lose that ability to create internal stability. So I'm going to show you 3 moves today that are going to put us into slightly more unstable positions, and these are going to be through 3 planes of motion: forwards and backwards, sagittal plane, side to side, frontal plane, rotational, transverse plane. Once we induce this stability, it's going to force our spine and muscles surrounding the spine to stabilize itself naturally. And so this is going to be one of our approaches that's going to help us in our pursuit of strengthening the lower back. Let's get into it. So what I'm doing here is I'm essentially adapting Stuart McGill's Big 3 and making the exercises just a little bit harder so that you understand that you can actually progress those exercises to a level that's something more applicable to you and where you are in terms of your strength. And so the first move that I'm going to do is going to be the plank, and that's going to help us resist flexion and extension, so it's going to be purely sagittal plane focused. I've done videos on this before, but just a quick recap. What we're going to do: hands under the shoulder, we're going to bring the tailbone down or the pelvis down, and then we're going to round the back ever so slightly and push through the hands as hard as possible. Now at this point, we just want to step one leg back without moving the hands back. So step one leg back, and it's important that we do exactly the same on the other leg. So you'll notice that when I move this leg back now, I didn't move back, okay? Now you want to make sure that you're essentially crunching in this position. So tailbone's down, rib cage is down, so essentially stacked. And if you do this correctly, this should be pretty challenging. Now, how long do you want to do this for? I recommend that you do this for 4 breath cycles. So you want to breathe in for 4 seconds, breathe out for 4. And the breaths that you take should be really deep, so really expanding the stomach and then breathing out until there's no air in your stomach. Now, the other thing that I want to mention here is I talked about one of the muscles that insert onto the thoracolumbar fascia called the transversus abdominis. And if we focus on our breathing in the manner that I just talked about with all the exercises that we do, that's going to ensure that the transversus abdominis is always being stimulated, as that's one of the important bracing muscles that are involved in all these movements. So make sure that you got your breathing on log 2. So the next move that we're going to do is the side plank, and this is going to resist motion in the frontal plane side to side. So we're going to do a full side plank. Let me talk you through it. So hand goes directly under the shoulder, and you want to push hard into the hand, and you want the humerus to come in slightly like so to lock out the arm. So there you're in a very stable position. Now from here, I'm just going to drive one knee out, push my hip up like so, lock out the leg. Now this is actually a fine position for you. And then if you start your breath cycles, you might start to feel a bit of a shake, which is actually what we want. We know that the muscles are stimulated. But I'm going to go into the full side plank, so extend this leg here. Now when I'm in this position, it's really important that your hips aren't kinked back. You want to really extend the hips, bring the pelvis into neutral, maybe stack one foot on top of the other, push hard, and then you go through your 4 breath cycles. So breathe in. Breathe out. And you'll see I'm shaking, which means I'm definitely stimulating the transversus abdominis as well as lots of other core muscles. And also because my hips are in this high position, we're going to be stimulating the adductors as well. So this is actually a very good exercise for stimulating muscles, not just around the core, I'm still shaking, but the hips too. So that's how you do your side plank. So next we need to bring the spine in a position of instability in the transverse plane, so rotational. And the way in which we're going to achieve that is to move the opposite arm and the opposite leg in a prone position. So we're going to be doing a movement called the bird dog. Hands directly under the shoulders, rotate the elbow pits forwards, stack the rib cage, so we kind of rib cage down, hips into neutral. And then from here, whilst maintaining that, I'm already feeling tension in the abs, but we want to extend one leg back as far as it can go and one arm forwards, like so. Now what we're going to do is we're going to bring the knee to meet the elbow, opposite elbow, like so. Curl all the way in and then push all the way out, like so. Now as we come in, let's take a deep breath in. 3, 4, and breathe out for 4. So you're going to do 4 on either side. And so those are the 3 moves that we're going to use in order to bring about some spinal stability. The next thing that we're going to do is focus on training the muscles that originate from the thoracolumbar fascia in an integrative manner. And the model that we're going to use for this is taken from Thomas Meyer's anatomy trains, in which he describes 2 slings that we're going to focus on today. There's the anterior oblique sling and the posterior oblique sling. So what we're going to do now is train the posterior oblique sling. We're going to train the opposite side glute and lat. So B stance RDL, what I want you to do first is get one heavy dumbbell, because we do actually want to tax the system in some way and get it to react. And we don't want to be using weights that are too light to just go through the movement without those movements being challenging. That's kind of the whole point of why we're doing these movements, in order to bring about some kind of adaptation, which is not going to happen if the weight's too light for us. So get something that's kind of heavy for you. So I've picked this up. Now what I want to do, stack the rib cage and then pelvis neutral. I'm going to bring one foot back onto the toe, and that's essentially my B stance. Hands comes out in front. Now, as I go down, I want to breathe in nice and deep and go down for around about 3 seconds. Now here, glute is lengthened, lat is lengthened. So we are definitely training the posterior oblique chain, and then from here, breathe out, nice and hard. The reason why we're focusing on the breathing is so that we're also training the transversus abdominis. And so that's how you perform the B stance RDL to train the posterior oblique sling. I recommend that you just do 6 to 8 reps, but also you want an RIR of no more than 3, because we don't want to fatigue you too much, as typically I will put these in a program at the start of a client session, almost as a warm-up, and I'll typically get them to do just 2 sets. So that's an approach you can use. So this next move is training the anterior oblique chain, and so what we're going to be training is the high adductors on this side. So I'm actually going to bend this leg for that to occur. And then on this side, the external oblique and the internal oblique. So same side, internal, external oblique. And the internal oblique is one of the muscles that attach into the thoracolumbar fascia that we've not focused on so much yet. So this is going to be the movement that's going to bring that about. And this is also because we're training the adductors, bring about some pelvic stability too. So what we're going to do, lie on the floor, get your weight set up. So I've got relatively heavy weight, opposite arm, opposite leg to ensure that we're training that anterior oblique chain. Then I'm just going to pull this into position like so. And then from here, I just want to keep this leg pushed into the ground nice and stable, push my lower back into the ground, forearm nice and strong, and then push the shoulder up as much as possible, because that's going to bring about just a little bit of flexion on this side before we go back down. And so again, we want to be going 6 to 8 reps, and we want to be hitting RIR no more than RIR 3, so 3 reps from failure. And as I breathe, or as I push, I exhale hard, breathe in nice and hard into the stomach, and same again. And then release back down. Now it's important, as with any chest press, that we have the elbow at a 45 to 60 degree angle. We don't want the elbows flared out too much. This is going to ensure that the pecs are in the best position possible in order to train this exercise. So final note, you can see that the big players on the thoracolumbar fascia there are the glutes and the lats. And so other things that we can also do is ensure good movement of the shoulder, so good shoulder mechanics to ensure that we can train the lats effectively, and also good mechanics, stability of the hip to ensure that we can train the glutes effectively. And if we do that, along with all the exercises in this video that I've shown today, we're going to bring about a very global approach to improving lower back pain and strengthening your lower back, because we're going to be essentially strengthening all the structures and muscles that currently aren't being stimulated to the degree that they should, which is bringing about instability in the lower back. And the whole objective is to ensure that the lower back, lumbar spine is as stable as possible. And that's the approach that we've gone through today. Hopefully you find those movements useful. Comment below if there's anything else that you feel like I should have added, or if you need any clarification on anything. Otherwise, I'll see you in the next video.